there, I'm Dr. Sarah Trunk with Balance Within Physical Therapy. Today I wanted to answer a question I've heard a few times lately, which was, why do I have hip pain when I lay on my side at night? So these have been patients of ours that have called and been really frustrated. They can't sleep well, and it seems that their pain's really located on the outside of their hips quite a bit. They feel uncomfortable when they lay on that side. Sometimes it's more uncomfortable laying on the opposite side when that side's on top. And oh my goodness, sleep affects everything. We just, can't function well or feel like our best selves if we're not sleeping well. Sometimes these patients will also have some pain with walking longer distances in those same places, or it might be worse if they're more active. But anyways, I wanted to talk about that and explain that a bit more and things that we can look at and do to help. So most often what's going on is that either they're irritated, so the outside of our hip is actually called the greater trochanter of our hip, and there are a lot of stabilization muscles that insert right on that knob of our hip. And so if those muscles are a bit weak, then oftentimes they'll kind of lock up to try to create stability for us. They're trying to help us out, but it can be quite uncomfortable. Another thing that can happen if those muscles are a bit weak is that our IT band, which is located on the outside of our thigh, can tighten up too to try to create stability, and that can kind of rub back and forth over that greater trochanter, almost like a windshield wiper, and create irritation. So all of that irritation and tugging and pulling just gets that part of our hip kind of angry. It happens quite a bit from walking and being on our feet a lot, and so it's all those things that we're doing during the day. We feel it later, and then either laying and putting pressure on that spot when we're laying on that side, or else if we're laying on the opposite side and the area of pain is facing up towards the ceiling, all of those muscles and those same tissues are on stretch, and they're tugging and pulling even more on that area at night, and it just does not feel great. So the quick solution for that is to put a pillow between your knees. It shortens those tissues and takes some strain off of them, and so that can give you some relief and help you sleep at first. But really, the long-term solution is getting to the root cause of this. And that involves doing some really great hands-on myofascial release work and manual therapies to loosen up those tight tissues so that they're not tugging and pulling and rubbing and irritating that greater trochanter area or that outside of our hip area. And then also gently getting those muscles stronger so that they're supporting us and they're not just locked down and hanging on for dear life anymore. In addition, making sure that our glutes are strong, our core is strong to offer support to those areas really helps too. And then making sure that our pelvis is in alignment. So if we think of our pelvis as like a big circle, sometimes what can happen from crossing our legs a lot, maybe even driving in the car or sitting in a funky position a long time, we can get some rotation happening. And instead of being a nice circle, things are out of alignment, and then all of those stabilization muscles can't work really well together because we lose this like force coupling that closes the pelvis. And so with that wonky, unstable pelvis, it makes it even tougher for those stabilization muscles we were just talking about with the hips to work really well and to be effective. So just restoring pelvic alignment can be really helpful, and it's amazing to see with some of the really simple, straightforward techniques that we offer at our practice, how just restoring alignment can be this really quick change in noticing that all of these muscles can fire and stabilize and support us better. So on the other side of things, we are able to give people relief from these issues. I wish always that we had a magic wand and it could be one session. It usually does take a few sessions but usually people make progress really quickly. And then in addition to not having this pain anymore when they're sleeping or laying on their sides or whatnot, they usually report that they also feel stronger, that they feel like they've got some of their power and their oomph and just enjoyment of life back, that they feel like they can walk longer distances and do more things around the house or with friends and family, and not worry about feeling kind of worn down and sluggish and tired out at the end of the day, because their muscles are ready for it and they're supporting them again. So those are a lot of the things that we do at our practice. So there are many other facets we look at and, get into those deeper layers if things aren't responding quite well. But hopefully that gives you a little peek as to what could be causing this from happening and what could make it better. So just know that there's help out there. We do offer free consults either over the phone or in person. So if you're experiencing something funky going on with your hips or anywhere else in your body, we are happy to be a second opinion or even a first opinion to see what can be done naturally without medications or surgery or anything scary like that, because oftentimes just some simple mechanical changes and treatments that we offer can make a world of difference. So I hope you guys have a great rest of your day. Thanks so much for listening, and I hope that was helpful.